Hello, good afternoon everybody. Now here we are the professors from the Department of Surgery and trying to help and analyze the mock test which you have faced, and I am very happy to see the analysis and result that almost all of you have scored above 35 marks out of 50. So I will not take more than 5 to 10 minutes to speak on the results of first 15 MCQ, because these MCQs were set by me, and first question, that is good salt's ligature, unfortunately very few people could give the correct answer, because the key was slightly ambiguous, and that was a mistake on our part. Ideally it should be the rectal partial prolapse, where the wall of the rectum which comes down, and that can be repaired with good salt's ligature. Unfortunately the key provided by our helper was wrong, and so he gave the key of rectal complete prolapse. Actually complete prolapse won't be cured by good salt's ligature. So most 80% of the students who gave the answer that rectal partial prolapse, they are actually correct, but unfortunately since the key provided was wrong, so they did not give the marks. So this is one important mistake in the first MCQ itself, and a similar type of mistake is seen in the question number 10, and that is distended abdomen in intestinal obstruction is mainly due to again the key. It is a technical problem somewhat, I think a typing mistake, but it is a mistake. So the 76.6% of the students gave the answer swallowed air, which is the correct answer, while the key typed by the department or the person who are interested is the diffusion of gas from the blood, which is the wrong answer. So these two mistakes I wanted to highlight, and sorry for the mistake, because ultimately responsibility is ours. So these 2 marks we can all of you, those who have marked the swallowed air, that is response C for the question number 10, and response B for the question number 1. So these 2 marks you can add to your total tally, and I again congratulate all of you for this new venture of giving the mock test online. One more small comment regarding the question number 12, and that is commonest segment of the large intestine that develop malignancies. Since the rectum is added, so in our country the rectal malignancies are more common than ascending and descending colon malignancies or sigmoid colon malignancy, taken into consideration as individual, not as a group. So that is that also a correct response given by 60.9% of the students, and I hope these things are going to stay, and we as well as students and we teachers must get acquainted with this type of teaching learning, and I again congratulate you for your result and very good performance in this mock test. Thank you. Good day.
We'll have to see whether there is any query on email. So we'll deal with that.
एक मेल आला है, one mail accepting responses test नहीं. There is no so far any mail.
ठीक आहे, आपण बोलू ना
नंबर वाईट आहे
आता 16 पासून बोल.
16. हा पहिला चुकीचा आला रिस्पॉन्स, हा ठीक आहे. ते बरोबर 129 मुलांनी बरोबर
ते तसंच कॉमेंट येईल.
Hello my dear students, myself Dr. Jorwekar, Professor Surgery. I will be doing the analysis of mock test 1 taken by the department today from 10:45 to 12. I hope the test would have given you the real experience of the exam, and I'm happy that the test was could have reached to most of you, and possibly like 192 students so far have appeared for the test, and I'm happy that the average score resulted is at most 40 is the average score, so that is I found really good and assertive. So I'll be doing this analysis from question number item number 16 to 35. Those were based on upper GUT. So that is 16 question. What about the renal cell carcinoma, involvement of adrenal gland. So from our side, there are some mistakes here. The actual response should have been T4, that is option number 4, but or option number D. But unfortunately, the T was given for T3, that is option number C. So that is a mistake actually, and it is found that 129 students have responded for T4. Actually, that is the correct answer. So that mark can be added to your already given mark. So 1 mark can be added by those 129, and 60 people have marked T3. That is a wrong key was given. So that is a wrong answer actually. For option number 7, item number 17, the Anderson-Hines operation. So naturally this is done for PUJ obstruction. So rightfully, like 185 students, up 96% of the students have marked it correctly, and that is a nice aspect of it. Item number 18, one of the following is a pre-renal cause of anuria. So spinal anesthesia is marked by the that is a right option, and 70 students have marked it correctly. So the percentage is 36%. 96% people have marked pre-eclampsia, and that percentage is 50%. But the correct option is spinal anesthesia. Item number 19, deep recess above the upper pole of kidney is a Morrison's pouch. So rightfully, like 183 people have opted for this option, and that is the correct option. Upper GUT anomaly which presents with urinary incontinence, rightfully again 154 students have opted for ectopic ureter, that is the right answer, and double ureter is slightly ambiguous here. Item number 21, for dysmorphic RBCs, rightfully again 187 students have answered correctly. Renal laceration of more than 1 centimeter is grade 3, again correct answer. 180 people have contributed, and that's a correct answer. Imaging work of choice in a hemodynamically stable patient of suspected renal trauma, again CT scan is a correct answer, and 189 up to 98% of people have answered it correctly. White stone doesn't contain. So again 190, that is a mostly answered question I think correctly. 190 students have correctly marked it as sodium, so that is the right answer. Type of urinary calculi associated with hematuria, again 162 people, students have correctly marked oxalate. Slightly phosphate and cystine has been there as a wrong answers, but attempted by almost 26 people. For item number 26, NTEP guidelines, National Tuberculosis Elimination Program, which is now revised from RNTCP, where now continuation phase for previously treated or recurrent cases. So it's a 5-month duration. So 74 people have students have answered it correctly. Against that, 73 have answered it for 4 months. So naturally now total treatment is of 8 months. So confusion is likely, but the 5 month is the correct option. So I'm happy that 74 people have contributed correctly. Clubbing of calluses, again 185 students have marked correctly, 96 is the percent. For findings of small kidney and delayed function, again chronic pyelonephritis, which is a correct answer, marked by 156 students. Extramural cause of urinary obstruction, again carcinoma colon, rightfully like 170 students have marked it as 89%, and again they have recognized carcinoma colon as extramural cause. This was about one of the syndrome, Lindau syndrome. So the cerebral angioblastoma, 184, 95% of the students have marked it correctly. Cellule formation as a urinary obstruction usually is supposed to involve urinary bladder, again correctly marked by 118, that is 94% of the students. Antibiotic responsible for renal origin of anuria, cephalosporin, that is the correct answer, 152, that is 80% of the students have correctly marked it. Against the ciprofloxacin, marked by 10% of the students. So I think that was one of the major distracted here in the is this MCQ. Type of urinary calculi associated with acidic urine. There is some ambiguity here, because urate and cystine calculi are supposed to be usually associated with the acidic pH more. Against the phosphate or triple phosphate struvite stones, all these are supposed to be more found in alkaline urine. So correct answer in this case was urate or uric acid calculi, which is marked by 34% of the students, and that percentage comes around 17%. So this question, I think, is one of the question amongst all, like out of 20 questions from upper GUT has given the challenge, and it was like possible for 70% of the students to correctly recognize the correct option. For 34th item, one of the boundaries, again 184 students have contributed correctly. For most common ion found in the urinary crystals is calcium. So again 187 students have contributed correctly, and the percentage is 97%. So almost like what I found here is more than 180 of the students out of 192 have marked the correct option in most of the items, apart from the one which is for urate, like acidic urine and association of stones. So most of the other options were correctly picked up, and that is a very good sign, and that shows that you must have attended most of the presentations from department time to time taken for most of the topic, and I am happy that the result is very good and followed by students have understood most of the things correctly, and that again will boost our confidence, and we have been successful in transferring what we wanted from our side to our students. So again, thank you once again from my side. I will hand over this dais to Dr. Dandekar, who is now going to do the analysis for 36 to 50.
Before I take up, let us see the email. If students have any query.
I think so far there is no any email on our account, so we don't have a receipt of any mail from the students about the feedback. So I think we can continue with the analysis which we are doing here. So from 36 to 50 items, Dr. K. Dandekar, Professor Surgery, is going to do the analysis. So.
Good afternoon, everyone. So till now, till 35th, you attempted it very well. The average score is more than 40%, very satisfactory. So let us consider the next few questions, which are based on the lower GUT. So the 36th item is thimble bladder. Yes, as expected, 180%, that is 94% student have answered it very correctly. That is thimble bladder, which after fibrosis becomes small in size, resembles to a thimble. That is why it is called as a thimble bladder. The next question is, aniline dyes are involved in the etiology of carcinoma of urinary bladder, and 187 student, that is 97.4 student have answered it correct as a aniline dyes. Aniline dyes, these are considered as an industrial hazard, and this survey has come in around 1896 in Germany. So nice, the first two questions are very correctly answered. Now third is the most common tumor of urinary bladder. Again, very good responses. 99.5% has because the covering epithelium of urinary bladder is transitional case, and as you have very correctly answered it as a transitional case. Well done. Now again, subcapsular orchidectomy is done for, so as 93% you have correctly answered. To stop the testosterone exposure, you have to remove the testes. So that is good answer, which is used for the as a prophylactic measure for the carcinoma prostate. The 40th question is related to the actually trauma of bladder and trauma of the urethra. So 90% have answered it correctly, that high riding prostate is seen in the cases of urethral ruptures. Again, very good. Now the statement regarding not true. Again I ask you to follow this. Every time you get an MCQ, when something negative is asked, it should be in a capitals and it should be underlined. So the answer is correct, that circumcision should not be done, because you can use that foreskin for the repair of the hypospadias. Now again, if you are seeing this as a wrong, this is a technical difficulty. 92% have actually answered it correctly. See, this is a Google form. Maybe we are not very familiar with giving you the. Actually, 92% have answered it correctly. The key is somewhere has gone wrong. The glandular hypospadiasis is the commonest. So I give credit to all of you that there is something wrong with the key. Whoever has written this as a, whoever what, 92% of you have answered as correctly. So the answer is yes, it's a glandular hypospadias, which is the correct answer. So you can add a tally of 1 to your already having a more than 40 marks. Again, very good. 96% have correctly answered to the as a varicocele, which is the varicosity of the pampiniform plexus. So it's almost 96%. Then commonest testicular malignancy, as almost everyone has predicted, is the seminoma. Correct again, 98. Very good. Congenital hydrocele. This is sort of a tricky question, but yes, 82% have answered it correctly, that you have to go through the inguinal approach and go for the herniatomy to deal with the congenital hydrocele. Again, 82% have attempted and given the correct answer. Hydrocelectomy is not done in congenital hydrocele, remember. So that alternative was slightly to distract you. And complication of varicocele includes infertility. Almost 95% have answered it correctly. Corneal gangrene, again 99.5% have answered it correctly. This is very common condition which involves the scrotum. Maybe this is actually a repetition, but slightly just a change of a statement. And as predicted, 95% has corrected. The testicular tumor has a better prognosis is 1. Now you will have to work on this, because unlikely site of metastasis in case of testicular tumor is, the answer which is given in the key is correct. That is the unlikely, because it will go to the inguinal lymph node in the stage 4. So all the rest, epigastric lymph node, or that means the para-aortic lymph node, supraclavicular lymph node or para-aortic lymph nodes, the testicular malignancy is likely to go there, but unlikely is, that is the last it will go to, in a stage 4 it will go to the, so the key is correct, but only 23% are able to point it out. And the last is actually, I expected less response, but all of you have predicted it very correctly, that it's a bladder neck obstruction, is also called as a Marion's disease. So again, for this last 15, your responses are very good. Almost of you have answered it correctly. Only the 49% which is unlikely, so you will have to again revise the lymph node metastasis. It is different on left side, different on right side. So the answer which is inguinal lymph node, which was supposed to be unlikely. Out of this 4, that was the answer. So again, congratulations all of you. If you have any query, you can ask it. Still we have 2 or 3 minutes. You can send your queries on the email. I will just go through on the email. Right now I don't see any of the response.
रिक्वेस्ट करायचं का का ते येतेच आपोआप येतच राहतं मेल आपोआप येत राहील ना म्हणलं कसं
Can you shift the V on to include all the 3? फक्त मी एकटाच दिसतोय.
हा झूम आउट कर
हां.
झूम केलं ना बरोबर आहे आपण
Right.
खेळत बसलो.
मग अशी सर सही करतात त्यांचं मोबाईल बघा
ठीक आहे ऑफिशियलच काम
So, do we conclude?
येस सर
Yes, sir.
Yes. So,
only thing if anybody wants to have clarification they can contact their CR and through CR they can contact any one of us that is the last comment.
and again, congratulations.
Vaibhav is there on the communication, so I have his WhatsApp number with me. So anybody has some query or any kind of a justification, so we are ready to discuss, and that those can be forwarded to Vaibhav, and Vaibhav can share it to me on WhatsApp, and then we can have a mutual discussion, and needed help can be given at the same time. So it is like you can
Yes, feedback. You add 3 marks to your total. I think we have already clarified.
yes, sir. So
That
3 marks can be added. So
there was some glitch, technical problem while feeding the key. The wrong key was fed for three questions, and that we have given you the correct answer. So
I feel like it was a very nice experience. We are also trying to improvise our Google Form technique next time, so you will not have this kind of confusion next time. Again, all of you getting more than 40 marks average, it's a good thing. Keep on, continue with your study and take care. Do we conclude?
yes.
And thank you, Rohit. We will conclude this session and congratulations again.
okay, good day.
Okay.